You know, you use your phone for almost everything these days. Well, now you can use it to find a place to get tested for the coronavirus. We're talking live with the app creator next. Well, wherever you go right now, everybody's obviously talking about the coronavirus. How could you not? We're all in the same boat. We're all trying to keep our families and ourselves safe. So what if we told you there is an app that can help you get tested for COVID-19? Something you'd be interested in? I bet. Here to talk about that, Tim Kaufeldt. He is the CEO of Laso Health, and he's the creator of a new coronavirus testing app. Tim, thanks for joining us. It's called the Laso app. Just kind of for computer folks or people like me who are not computer folks, kind of walk us through this. How does this work?
Absolutely. So thank you, David. So the app is free in the Apple Store and the Google Store for download. It's free to download. What we offer is we offer two options for people. For people that have symptoms or fear or have been exposed to somebody that is tested positive under the CARES Act of 2020, that's generally covered by insurance or the government for uninsured folks. And they simply go through the app. They will be given a telehealth appointment at no cost just to determine the actual need for the test, which is important. They'll be given either a same day or next morning testing site slot over in the medical center, which is hosted by our partner group, South Texas Renal Care Group. And then they'll get the test, and generally it's running about 4 to 5 days right now, just because of the volume on results. But the other option for people who have the means to do so and simply want to get tested for peace of mind, we also offer the ability to pay through the app for a elective test or an antibody test, which will determine if you've had the test before.
So a lot of questions here, and some of it may be repetitive, but I want to make sure our viewers understand. Anybody can schedule appointments?
Anybody can schedule an appointment. You know, we set it up the way that we did so that there's a mode for both people. For people that have been in contact, which many have, with, say, a family member or somebody at work that is fearing that they have. And I do want to add, it's best to test 5 to 7 days after the exposure, after you know an exposure, just to make sure there's enough of the virus to detect. The other side of it is that if you're somebody who simply wants to get tested, maybe you haven't been exposed, but you want that peace of mind for your family, or maybe you're traveling, you have the ability also just to order a test through the app. So
we got about 20 seconds here. I hate to put you on the spot, but I mean, this is you are changing the way folks are doing medicine business right now.
Yeah, we absolutely, we didn't start with COVID, but we wanted to help people access physicians for an upfront transparent cost. When COVID hit our staff and shut down doctors' offices within 48 hours, we moved to the COVID response. South Texas Renal Care Group has provided all of the medical assistance. They're fearless, they're running an excellent job. And a quick shout out to those people who are putting themselves and their families 3 feet away from sickness to give the rest of us peace of mind.
Tim Kaufeldt, CEO. It's called Laso Health, the Laso Health app. You go to the Apple Store, you go to the Google Store, wherever you buy your apps. It's free. Again, Laso, L-A-S-O. It'll take it from there, and you download it, and then it'll kind of walk you through all the process. Tim, thank you so much for being on this holiday weekend. More importantly, thanks for what you're doing to keep everybody safe. Thank you, sir.
Yes, thank you so much. Appreciate it. Take care, everyone.